with other science of information and multi-system involvement, SLE should be kept in mind, or rather any autoimmune diseases should be kept in mind, and investigation should be done accordingly. 4 out of the 11 criteria which we have mentioned is sufficient to make a diagnosis of SLE, and early and intensive intervention often alters the natural course of the disease. Thank you.
Why it is seen in young ladies?
Young means we are basically targeting the 40 or 50 age group when the basically after the postmenopausal, because the estrogen effect gets cut off. So that is one age when there is a flare of autoimmune activities, and because the interaction of environmental and genetic factors, and X chromosome is one of the major culprit in all the pathogenesis of SLE. So presence of 2 X chromosomes makes the disease more likely, and also based on various studies, both the number of X chromosomes, like we have XXY or other unified features, their SLE features are even higher.
Anything not related to young?
Like we have seen, X chromosome is one of the culprits.
So that is ladies. So young means a particular age group. Why there is so susceptibility?
Because it's a interaction between the genetic and environmental factors. So the chance of an anti-antibody immune complex is more in the active persons.
Early age. It is seen in very early age.
Mostly adolescents and adult. Adolescents and adult, female. Genetic factor, environmental factors. Then there is immune modulation, tissue injury, damage to the target organs. This you can see.
Mostly it is most of the autoimmune are female dominant. And here this is the 15 to 50.
15 to
reproductive age group.
Adults
Starting
and
of the
adults.
menstruation period to the these are the group. Yes.
9:1 is the ratio.
9:1.
So
So
it
high.
is a female dominated most of the autoimmune. But it is not only the end of the, it is the early in the beginning. That is the reproductive age group. That is the why there is no thing clearly it is related to hormonal estrogen, the starting of this. But one theory is that it is related to always beginning of the reproductive menarche to the perimenopause. These are the group and a strong female, except few diseases like ankylosing and this male dominant.
It's almost 9:1. The ratio is
9:1. So very high.
But
so many SLEs, if we have 15 our data in hospital sir. So many
butterfly
SLEs.
rash is one of the major diagnostic criteria, and it has derived the name itself.
Dr. Samrita.
This patient is particular, this is a Gurum, she admitted to our hospital given medical order. That is what your lab, I think this is related to this one. She admitted with the history of the aesthetic distress. She came 2-3 times to our hospital. Initially, she presented with this new setting of body and this breathlessness and reduced appetite. So we found she has got the mother rash was there. And the diagnostic area out of 11, 4 was fulfilled. There is AN positive and anti-DSN was there, and malaria was there, and the leukopenia and this granulocytopenia was there also. So we diagnosed the patient is there. And we started also because we did a biopsy to found to be lupus. What is lupus? Why this has come up? Lupus is a Latin word. This is in the 18th century when it is recognized. This is system lupus. This is lupus is the bite of wolf. Because due to this discord rash, they thought this Latin word, they thought this meant due to wolf bite. But subsequently found this is autoimmune disease. So this has come from this 18th century, it has been recognized. Lupus. And this is the, as already it has been discussed, this is due to both the environmental and genetic mutations this has occurred. And this lupus also in the infant lupus is a self-limiting disease. And it is a multi-system environment. So it mimics the disease, many diseases. So it is known as also alternatively that is a great imitator. When it has got a different diagnosis, you can with this multi-system you can also come for any differential diagnosis with the involvement of multi-system, you can cover the multi-system disease, SLE is one. And why you are so much weak? Because for the particular lupus nephritis, stage 3 to stage 5, that is quite important, and we give both aggressive therapy. In our hospital, earlier we are using already we have got 45 or 50 patients will be there. We give the aggressive therapy to lupus nephritis with the IV cyclophosphamide first day, because of the methadone. Subsequently, 27 days the oral prednisone, 0.5 milligram per kg. This we go for the 6 months. Then subsequently, for the after 6 months, we go to only methadone, oral prednisone, 0.5 milligram kg body, along with either azothapine or mycophenolate. Earlier we are using azothapine. For last 5 years we are using mycophenolate. That's maintenance therapy. Once patient have how we know the patient's disease process has come down, we do the after 6 months or 1 year we go for the anti-TSG, seeing the titer. Then accordingly we continue the treatment. If it is a relapsed patient, we give again this chemotherapy aggressive therapy. Instead of 6, we go for the another 3 more. Same cyclophosphamide and methylprednisone, and continue for the 3 years. We have patients, those they have already more than 14 years, 15 years survival. In USA, this prognosis is 95% survival with lupus nephritis. SLE is 95%, 10 years survival is 90%, and 20 years around 72% survival with the modern therapy. Newer drugs has another is the one basilimumab, which is 10 milligram used to be given, 0.3 doses will be there. And recently there is a literature come they are giving with comparison study with the tacrolimus. You go for the 1 year tacrolimus, 0.12 milligram per kg body. You go for 1 year, and the versus with the steroid. So they are efficacy wise both are same. So tacrolimus has come up already. This is, I think the journal NDT it has come. This is recently it has come. Rituximab, yes, rituximab is already recognized. They are giving the paper. I guess already it has been. Basilimumab, newer drug has come up. And tacrolimus they are giving in the instead of the giving mycophenolate, they are giving the comparative study was the tacrolimus. This one study has come. This recently 6 months. This study is from they are giving also tacrolimus. Along with steroid, giving good result. 1 year they have to give it for 1 year. Tacrolimus. Prognosis wise also good, and regarding transplantation, yes, we had got one patient. We did the first therapy with the aggressive therapy.